Afternoon tea. For the Mullaneys, this feels like borrowed time.
My wife actually, according to all the doctors, should not be with us today. She died on the operating table. Tastes pretty good.
It happened 3 years ago when the Mullaneys were on vacation in Florida. Mel developed a kidney infection. She spent 5 days in an induced coma, 10 days in hospital, and had to be flown home on an air ambulance. The bill came to more than $200,000 US. The entire amount covered by their travel insurance bought from RBC. But a few months later,
all of a sudden I see all this money finally coming out of our accounts.
RBC recovered nearly half of their total claim from Mel Mullaneys' extended health plan with Pacific Blue Cross. That amount came off her lifetime coverage maximum. That's all the coverage she has for vision, dental, medical devices, and drugs for the rest of her life. Mel Mullaney has diabetes. Her drug costs alone total nearly $2,000 per month.
At some point, that's going to be eroded maybe in our lifetime, and so that's very much of concern.
The money RBC recovered is part of a form of cost sharing among providers. It's a completely legal standard insurance practice, and it's all spelled out in the Mullaneys' RBC policy. But the Mullaneys say they didn't understand any travel claim would be counted against their extended health coverage. In a statement, RBC says it's very important that clients understand their existing coverage as well as the details of the policy they are purchasing.
At the end, we are ending up paying our personal insurance is paying for it. More companies.
The Mullaneys went with RBC because it was slightly cheaper. Had they bought travel insurance from Pacific Blue Cross, their claim would not have counted against their lifetime coverage. Ultimately, they say that decision ended up costing them a lot more. Aaron Saltzman, CBC News, Toronto.